Okay, Naoki. So I've already read your bio, so the listeners know what you have done. But before we even get into the topic, talk about who is Naoki. What
Mm,
information you didn't put on your bio that the listeners would want to know?
well, I think something that people would probably like to know is how did I really get into social work? Right. Like, and the bio just talks about the, big ticket items. It doesn't talk about, trauma and grief and, all of those different things that makes mental health or counseling appealing. So I think um that's my real story is that, I ended up orphaned essentially, and raised by my grandparents after the unexpected death of my mom. And so that experience led me to have a therapist, and my Southern Baptist grandmother, who was progressive, was like, I think you need to see a counselor. And so I'm like, okay. And so that experience, even though at the time didn't feel like I got much out of it, helped me to understand that I probably could do that for someone else. And so that's how I became um, a therapist. But I think I've always been a social worker.
And what I'm hearing you say is the backstory is really that won't ever make it to the bio. The trauma that led most of us to this career is the part that is essentially who is Naoki. Some of those early events in your life formed you as a person. And I'm not gonna get into your trauma story in this episode because we're really here to talk about Black therapists. But you mentioned seeing a therapist as a young child, and can I ask, was that therapist Black?
She was not. She
Mhm.
was not Black. Um, and to be honest, I think in the early 90s, therapy was still taboo to Black people. I
Mhm.
mean, kind of is still taboo now.
So how did you decide you could become a therapist, seeing as we didn't have any role models? We didn't see any Black therapists, we didn't know any Black therapists, and we didn't know Black people going to therapy. What made you think I could do that?
Well, honestly, I didn't think about it as, I just saw it was something that was greatly needed. I felt there was so many different people that I've met in my life who could benefit from therapy. So I felt that I could provide a service for people who looked like me and who had similar experiences. And I think even thinking about my experience, I think if I had someone who looked more like me, I may have been more comfortable, more engaged. But because of that, it wasn't a long experience. I kind of like, she doesn't get my language sometimes. She doesn't understand some of our colloquialisms. And so I think that made me disengage a little
Hmm.
bit.
And even though you were 9, you understood that it was important not to have to explain everything to the therapist, that they needed to just get some parts of the language.
Absolutely.
Hmm. Now we both, obviously we know each other, so we should probably disclose that. And so we both are therapists, and even though we have totally different stories on what led us here, similar experiences as far as not having that role model, not having that, person in our lives that looked like us, that was doing the same thing that made it seem easier or possible. So I wanted to know, did you get negative messages when you said I'm going to be a social worker or I'm going to be a therapist from anybody?
Oh, absolutely. Especially social worker, you gonna
Okay.
take people children. That's the first thing, right? Everybody thinks we are coming with the clipboard to take children away. You're not gonna make no money. Um,
Oh wait, don't say pause on that one because that was a big
yeah,
one for me.
yeah.
I was told I was going to be poor. Um,
Mhm.
Now you don't have to disclose how much you make, but are you poor?
No, I'm not poor. But in my journey, I met a professor who told me that he wasn't poor. And I
Okay.
think that meant a lot. That meant a lot to me because he had several businesses. He was into politics. He was just doing everything. And so that inspired me to be like, oh no, I'm not gonna be poor.
Hmm.
That's not the
But a
life
lot of
God has for me.
family and friends were saying, "Oh, you're gonna be poor."
Absolutely family. Absolutely family. It's like you're going to school all those years to be poor.
Hmm.
That just doesn't make sense, you know. So um yeah.
Did you have any fears about doing something? Because basically, you're innovative. You were doing something that very few of us are doing. We're in a small group, so less than 10 to 12%, I think, are therapists are Black. So we're in a very small minority. Any fears, imposter syndrome show up?
Oh, absolutely. I mean, um I work in different spaces, so especially in telehealth. So part of my experience in telehealth has been on the West Coast, and now I'm working more primarily with people on the East Coast in New York. And in most of those spaces, I'm the only and lonely
Mm.
person who looks like me. And even in some situations, I'm the only person with a thick New Orleans accent. And so all of those different things. I may only be the person from an HBCU.
Right.
So it's all of these different factors. And I might only be the only plus size princess too, right? So I mean, so all of those different things can be issues um, that impact my ability to feel like if this is a safe space. And there is some gaslighting that happens. There is definitely microaggressions that you
Mhm.
experience, especially when you say you're from New Orleans. And people say, how did you make it through Katrina? I'm like, I don't know. I wasn't here. I evacuated, so I don't, I mean, I know it was bad.
Mhm.
But I was watching it from my hotel, like everybody
Right.
else was. And I think um there is such a misconception, not just with being a Black therapist, but so many other factors that plays into being a Black therapist and trying to create a safe space, not only for the people that you see, but also for yourself.
Right. Right. Because it's hard to take on any of the clients' emotions when you have all your own battles you're fighting just to get to that space to be able to take clients. And it's a lot. And I hear you saying there's so many different labels that we carry. So it's not just being Black, but Black from the South, which is a different perspective. Black from the South and educated by Black at a HBCU, that's a different layer of, whether or not people find you to be competent. Now, I know your resume, so I know you're one of the best.
I am.
Is that how you overcame? For myself, that's how I overcome imposter syndrome is by almost
Mhm,
by overdoing it on the resume standpoint. If there's a evidence-based therapy, I want to get certified in it so that you can't
mhm,
question my resume. And I find that sometimes our counterparts of, the majority race, they don't feel that way. They don't feel that
mhm.
pressure that we do, that we have. Did you ever experience that?
Well, I think I've absolutely experienced that. And I think the other part is, I've been in situations where been licensed for many years, and my counterpart may not even have a license, right? Or she may have just been
I've had
licensed.
that, yeah.
And you're like, we in a real world, I would be your mentor, right?
Hmm.
And so I think when it comes to the industry of a licensed therapist, it's layers to social work and therapy, right? So, when we talk about um, all of the things that, I may have accomplished in my career, I kind of feel like I had to do those things just to compete, right?
Hmm.
Because the reality is I can have all of these things on my resume and someone of a majority race can come in and just knock all of my accomplishments down to a minimum, So I think part of it is what I feel, but also part of it is my reality.
Do you think clients sometimes see us as, as Black therapists as less than? So we know, maybe society may feel that way, but do you ever think Black clients see us as less than, like the Walmart of social work?
I don't think so. I think, well, you know what? It depends, right? Because I think most Black people that I've interacted with, they enjoy me. I'm like an auntie, sister, cousin, so I'm funny, I'm fun. You want to come to therapy, you know. But I think it just depends on that person's experience, right? Because I am funny, I'm a sister girl, home girl. But if
Mhm.
everybody doesn't want a sister girl, home girl, somebody really wants a more reserved, conservative Black therapist, and they have those too, right? And so I think it really just depends on the temperament of the client or the patient of what they're looking for.
Right, right. And I'm gonna say that I do think sometimes, I'm very approachable. That's what I try to be. I call myself regular as a compliment. But I do find that for myself, sometimes I think the client's sister home girl a little too much. You ever had that?
Mm-hmm.
Where it's almost like they won't go get drinks after,
Mm-hmm.
you know?
Absolutely. I think it is important to set those boundaries.
Hmm.
I'm throwing my little girl a graduation party Saturday. You welcome to come. I'm like, well, I can't come, but I know how proud you are, right? And so
Hmm.
I think it is just on that end about the therapist setting that boundary, like, and I set those boundaries all in the beginning. I'm like, hey, when I'm going through my forms and my confidentiality, I say, I live in the community. You may see me at Walmart. I'm not gonna speak to you. I'm not acting funny,
Hmm.
but but if you see me and speak to you, I'm gonna say, hey, how you doing? But I'm not gonna approach you first. And so I might see you at basketball games, football games. And so I try to make sure we're like clear on those boundaries early. But as you meet with me for 8 weeks, 12 weeks, they forget about all of that stuff.
Right.
They want to be your friend because it's a comfortable, safe space.
You're a big part of their life for so long. And you said 8 weeks, 12 weeks, but sometimes, honest truth is therapy could be 52 weeks. And
Mhm.
you may go on a pregnancy journey with somebody, and of course they want you to see the baby. I met you when you were trying to conceive and counseled you throughout the pregnancy to the book.
Mhm.
And the honest truth, as a therapist, you want to see the baby too, right?
Absolutely. I want
Or
to
you
see the
want to
baby.
see the wedding pictures.
I want to see the pictures. I want to see the dress.
Hmm.
I mean, I think those things are, to me, that's not crossing a boundary. I think it's human nature to want to celebrate a major milestone in someone's life that you interact with on a regular.
Right.
But I can't go to the wedding. I
No.
can't do the Cupid shuffle. And I can't catch a bouquet. I can't do that. Those are
That
I can't
honest
do
truth.
this.
I can go to the wedding. I can't go to the wedding, but I can't do the Cupid shuffle even if I came to the wedding. I forgot how to do it.
Yeah, I don't know. To the
I
left.
don't know how to do it either way. So,
They have the directions, Candice. Just pay attention to the song.
oh, you got to listen to the music. You got to listen
Yeah.
to the words in the song. All right. So I was when we were talking about like the negative messages from family and friends, and I didn't ask you, but what about did you think society told us that therapists are white? And I'm just talking about like media.
Well, I think society and our overall culture, right? I mean, I don't want to lump everybody in, but Southern Black people in most situations, we take it to the Lord in prayer, right? I
Okay.
mean, um, and so my thing is you can go to God and pray and you can get a therapist too. Like you can pray and you get a therapist too. And so I think that had more to do of it. And then also that other aspect of we don't put people in our business. We don't tell our business.
Right.
Family business is family business. Um, and you don't go tell those white people your business, and
That part.
so all of those are real things, and I think maybe that has told it to us more than society,
Mm.
because it was just culturally, we just don't put people in our business.
And so
And
you're
I
thinking
think
maybe
that, mhm.
I'm sorry, but you were thinking society made, and I'm thinking more when I say society, I mean more media. You're thinking it's reflecting what we had as a reality. So Meaning, can you name a black therapist? Like we all know Frasier, right? But can you name a black therapist from television or movies?
Mm, not anyone that was popular.
I know that the
Um,
new In Therapy, In Treatment, which is a HBO series, does have a black therapist that so I don't know
I
if you
saw
ever
that.
seen it, but I recommend it. It's complicated, so I'm not going to review that show. But that is the first time I can recall a leading black role of a female therapist. I think even on black shows, like I can remember when on Girlfriends, Tony went to therapy. She went to a white therapist. So even
Mhm.
on a black show, I cannot recall, and I'm not saying it hasn't happened, but I can't recall a significant role of us as a black therapist.
I remember one. Was it Whitley? She was who that was kept saying relax, relate,
A
release.
different world. Thank you.
Yeah,
Yes, it was.
I
You're
remember
right. That
that.
was one. That
I
was
do
one.
remember that. But you're right. I don't. It wasn't popular. I mean, not like and I always tell people like, the Cosby Show made me maybe envision having, you know, a doctor and a lawyer husband. I mean,
Hmm.
a doctor and a lawyer could be married and be Black people, and different world made me want to go to HBCU and pledge in a sorority, right? And so I think you're right. If seeing more images like that, I think would create um, that idea that there are more Black therapists. And I think we hear a lot of times that there aren't a lot of Black therapists, but I actually know a lot of Black therapists.
Right. Right. And I,
So I
yeah.
don't think that is a true statement. People will say that, but there's a lot of Black therapists.
I think based on the numbers, so if we just look at statistics, statistically, we are a low percentage of the license uh, in each area. So as far as the psychiatrists, we are the lowest percentage of psychiatrists,
Mhm,
psychologists. The APA recently in 2021 apologized for some of their racist practices, which stopped
mhm,
blacks from becoming psychologists. And so I think as an industry, we're a low percentage probably of most industries because of the history of the country.
mhm,
But yes, there are a lot of black therapists, and now we have social media, which is a great platform to connect with other
mhm,
black therapists, and for clients who are looking for a black therapist to find a black therapist. So we have things like therapy for black girls and clinicians of color, and other places that you can find black therapists, which I think is really cool that it's more approachable.
mhm.
I'm going to shift a little bit. Well, before I shift, I want to ask you one more question just about you as a therapist. When describing yourself, do you often say, I'm a black therapist, putting black first, or do you put therapist who's black, meaning you put therapy as your identity first?
I don't know. I guess I never identify or describe myself as a Black therapist. I think everything about me embodies a Black therapist. So from the moment you speak to me, you know you are going to get a Black therapist. And when I
Mhm.
show up on a Zoom or in a room, I I think it's already I've never had to describe that I was a Black therapist. I used to just say I really say I'm a social worker or I'm a licensed clinical social worker. So I identify as a social worker.
And that's a
Um,
good point you made just now about the identity, because sometimes clients are looking for a therapist, and when you say I'm a social worker, they get confused. So
mhm.
please, could you just for educational purposes explain what a licensed clinical social worker is?
So a licensed clinical social worker is a social worker who has a master's degree and who has completed 2 levels of professional licensing exams to be identified as a clinical social worker who could independently practice clinical social work therapy, provide interventions, and bill um, as a provider. Um, because they're independently licensed. So just like there's counselors are licensed practical counselors, they're LPCs or LMFTs, they're licensed marriage and family therapists. Um, And so there's LCSWs, licensed clinical social workers. And that is what I am. And the reason I say social workers, because social workers, we run the gambit of things that we can do. We
Mhm.
work in the hospitals, we work in every capacity. And the biggest difference about social workers in comparison to the other professions is that we have a generalist perspective and we look at all of the needs. We don't just focus on the therapy aspect. So we may even provide some case management. Social workers are
Mhm.
known for addressing case management type issues in their clinical work, because when we talk about something called Maslow's hierarchy of needs, we identify that sometimes just the basic human needs are not met. And those are the things that may be causing distress, like depression or anxiety, because you're worried about where you're going to live, you're worried about what you're going to eat. So maybe if I gave you some food, then you won't be worried about eating, and some of that anxiety might go away. So that is the difference.
And I'm gonna segue, I mean not segue, I'm gonna piggyback on what you said because you made a big point, and I want to make sure we drive that big point home. Of course, I'm gonna have to admit I'm biased. I am a licensed clinical social worker as well,
Me
and so
too.
I, I, I believe that the social work approach of seeing the whole person in their environment is best. But there's also research to back up that Black people, especially Black males, are overdiagnosed with serious mental illness because of the lack of looking at the societal forces that are played on them. And so oftentimes things like the trauma is ignored and
Mhm,
the symptoms that they present with are over pathologized to the point
mhm,
that they're getting diagnosed with schizophrenia and things such as that, when it's really more post-traumatic stress, or like you said, if your basic needs aren't met, that can cause you to have anxiety. But is it the anxiety that came first or the poverty? And so the social
mhm.
work is much more able to look at a whole. And I'm not saying other mental health professionals don't, because they do as well.
Mm.
But again, I have to admit I'm biased. I think we do
Yeah,
it best.
yeah. I think that too, I think that case management piece, I think is important. I feel like a good social worker or a licensed clinical social worker should start as a case manager. Like, you need to know what the issues are. You need to know what it is when you see it. You should understand the difference between anxiety and hunger,
Hmm.
or um depression and poverty, because a lot of times poverty is traumatic,
Right.
and real poverty is really traumatic. And so sometimes we may see things that seems like it has a pathology of a DSM-5 diagnosis, but really it's just poverty.
Hmm.
And I think sometimes having a ther not every Black therapist understands poverty. I mean,
Right.
I talk about my children who live, I would say, a life of privilege. They have no clue. But I think even just being able to see someone who looks like you may help you to disclose the type of poverty that you have. Because remember, we can't tell our business to those other people.
Right.
So I think that is a big, and I've read something that said that they're really starting to look at the trauma of poverty, because I always say that,
I've
you
been
know,
saying it for years too. I've been saying
yeah.
poverty is traumatic. And another point you made though about just as far as just because you identify as a black therapist or a therapist who's black, it doesn't mean that you're gonna understand every aspect that a client has gone through. But I think sometimes we provide hope when we don't have those similar experiences. So when you are a married woman raising your children in a nuclear family, for the client who maybe doesn't have that as her experience or their experience, that can also provide them hope. So, if your children
Hmm.
have never experienced poverty, that gives hope to the client that, oh, wait, poverty is not synonymous with being black. Because I think for so long we thought some of the negative experiences associated with being black were because we were black, not because of the system that imparted
Mhm.
those things on us. So I think that that is always, hope that you're doing well. Your clients love to see how well you're doing because then they know I can do well too.
Miss Katie, she got a new car.
No, they
You
love
know,
it. They love
they
it.
love that, and I spent some of my career working at school based, and my boys, they would be the first person to see that's you, Miss Naoki, and so I think all of that, being able to have that empathy for someone to understand, okay, um, even though I may not have that experience, you know, I'm here, I can still relate to some of your struggle, right? Like I may not um relate to your sexual abuse or trauma related to that, but I can relate to what it's like to be a Black woman,
Right.
or I mean, so those are something that I can definitely understand and can give a perspective and how it feels to just be a Black woman sometimes.
Right.
Um, so yeah, I agree.
Because I think that's the part that, all the trappings of success will never take away the fact that you still have to experience this world as a Black person. And so you don't go in Walmart with your degrees and, showing them your car keys and your house keys. You experience Walmart as a Black woman. And I keep bringing up Walmart, but any kind of store,
Hmm.
or any kind of space you are in society, you don't have that ability to, present your resume. And so that doesn't, you have experienced the racism of this world or whatever the experiences as Black people we experience. Success does not stop that. It doesn't shelter you from it or buffer you from those experiences.
No, and it doesn't prevent you from, the racial trauma of seeing George Floyd murdered on Facebook. Like
Right.
it doesn't take away the pain of seeing, you know, the beautiful city of New Orleans struggle so much with crime. It doesn't stop you from feeling like people are sometimes being left behind in the education system. And
Mm-hmm.
we know which communities are being left behind. Or it doesn't stop you from feeling like, how, New Orleans is a predominantly African American city, but why are the charter schools filled with a higher rate of people of the majority race, right? How does that
Mm-hmm.
happen, right? And
Mm-hmm.
so it's like you are trying to, you continue to see these things, and we know that race and culture and socioeconomic status always impact those different things. And so when we just think about our profession and all of the different layers of things that we have to deal with in a profession, and the buffers that we have, the protections that we have to put in place for some of our patients, um, it's a constant struggle that we're trying to, do. Even when we think about, okay, do I take Medicaid, right? Um,
Right.
right? Because I know that I want to be able to serve the populations
Right.
of people who would benefit the most from it. And again, this doesn't mean that this is predominantly Black, but I'm just saying I'm a Black therapist, so people they may Google Black therapists in Laplace,
Mm-hmm.
and so because they specifically want a Black therapist, and I'll pop up. But sometimes there are just certain barriers that prevent us from serving the populations that we want to help the most. So
I think that's a huge issue that I'm a sidestep for today because I
yeah,
think we'd be here all day talking about
we will
that.
come back to that one.
We'll come back to that. So one of the things you talked about earlier though was just the communication and the ability to, code switch is the, word that we use often with our clients and being able to understand the language. Now, do you find that as you're aging, and I'm not calling you old, but we getting older, that it's getting a little more difficult to be able to keep up with the language of the youth.
That's cap, Miss Candice. Um, yes, I mean, of course. I always laugh. I said I never wanted to be that lady that didn't know how to work stuff, but here I am, not knowing how to work TikTok. I mean, I'm gonna
I feel
confess,
I feel targeted.
I
You
I
hit me with
don't
that one because I don't know how to use technology. You're always helping me. So
know.
yes.
But yeah, I do. I think the language barrier is becoming an issue as I get further and further, and as our kids start to age out of school, and
Hmm.
we don't have to hear the side conversations. Eventually, we won't know what they're talking about if they're talking at all because they're texting so much. Um, but I agree with that.
And so, what other benefits are there for being a black person to having a black therapy? If language, and we both agree, language is a huge one, but those colloquialisms change, and it's hard to keep up with them.
Well, I think culturally, I always say no matter where I go, no matter where I travel, Black people are the same everywhere. We kind of do some of the same things, right?
Hmm.
And so I know that I can remind you of a sister or a cousin or auntie or a teacher or somebody who may say or do things similar to myself. So even if I don't speak exactly, I think my gift, one of the best gifts that God gave me, and I learned how to hone in on it from my grandmother, was I have the gift of gab. I can make you like me, even if you don't know me. So I'll just start talking to people, and and I think that helps. I'm funny, so I use humor a lot in therapy. So I'm going to say something funny in the first 10 minutes to lighten the
Hmm.
experience because most people are looking at you funny, like, oh Lord. And and so I'll say something, and I think that helps. So trying to find ways to connect, like trying to engage. And I thought, I also thought for my own self, like, maybe it may be difficult for me to engage with people of different races. And then, I'm seeing 60-year-old white men in therapy. And, you know, I'm connecting with Latina women and white women and gay women and straight women. And so I think I'm my best self when I'm just being myself.
Hmm.
And that works for me. Me being me works for me.
And so, having the similar identity to your client is helpful, but it sounds like you're saying not necessary.
I feel like it's not necessary. I don't think it's necessary. I think you could absolutely connect with a therapist of a different race. I don't think that you have to, because you can get a Black therapist that you absolutely don't like, never want to see again,
Hmm.
right? And so I think race is a helpful a racial connection is a helpful tool, but you still have to do the work.
And again, obviously, I know you, so I know you don't over rely on that, and I want to make sure the listeners don't leave away thinking that you sister girl, home girl, you're a highly trained therapist in multiple evidence-based techniques who uses it as an approachable, you bring it as an approachable way, but it's not just all sister girl, home girl, which is why you're saying I can use my therapeutic skills and it's transferring amongst multiple identities because I have
Absolutely.
skill.
Absolutely. I think again, um having a preference of therapy. There's nothing wrong with having a preference,
Hmm.
In most cases, we call it matching, right? So, if you identify in the LGBTQ community, more than likely you want somebody who is also in that community, right? Or
Right.
you may be a Black male who wants a Black male, so I think that helps in checking off one of the boxes, right? Like, okay,
Right.
this person looks like me. They have some of the same identifiable demographics as myself. However, when you get into that room, everything is not for everybody. Again, some
Right.
people may, some people they have a idea of what therapy is going to look like. So they're like, I want, I thought you was gonna have a clipboard and you was gonna do it this way. You're not doing it that way. This is not what I want. And then some people are like so nervous, they just want somebody to help them to feel comfortable. And so, I mean, I've met people that just didn't feel like I was their cup of tea, and that's fine. I think it's just about trying to find a person who you feel like you can connect with the best, and having a therapist who looks like you eliminates one of those barriers.
And I believe the same thing. And from a personal standpoint, when my family did try therapy, and I say try, we may have had 3 sessions, and it was very evident that the therapist was not able to um, break down the walls. So we
Mhm,
present well as a very, happy family. We know how to sit on the couch, and
mhm,
everything is fine. And she wasn't, no lack, no shade to her. She was I'm assuming, very great therapist in her own right. But she wasn't able to really look beyond y'all have to be going through the trauma that you have presented with, the reason you're in my office. Y'all carrying it well, but I know it's heavy. She just kind of let us go with oh, okay, y'all got this. And I don't know, in my mind, because we didn't switch to a black therapist, I just was like, well, I got this because I'm a therapist. But in my
mhm.
mind, I think a black therapist would have said something that would have broke down that wall. It's like, you know, your family not around. Y'all not good.
Well, I think I saw this somewhere, but I'm gonna steal it. I don't know who the author or who the person was that said this, but we have been groomed to wear our pain gracefully.
Hmm.
I was groomed by my grandmother, and my aunts. My mom passed away. I was 9 years old. I learned to sit on the front pew of the church gracefully, gracefully at
Hmm.
9 years old, right? And I learned that we go through stuff when we just pull our stuff up by our bootstraps. And I think a lot of times we see people functioning in high functioning depression, right? High functioning depression is wearing your pain gracefully,
Okay,
right?
so now have already established you coming back as a podcast guest because we need to talk about that.
Well, I mean, and I think when you mentioned that, I mean, that is the reality of what they knew to do. That was even, and nobody told me to wear my pain gracefully.
Hmm.
I learned from example,
Right.
right? Everybody telling me you could talk to me, you could talk to me, and you like, but I'm in my mind, I'm really knowing I can't talk to you. I see your pain, like
Hmm.
I see it all over you, but I also see you pretend that it's not there. So
Right.
I pretend that it's not there too, right?
Right.
And I think that is a big factor for Black people, and I'm just gonna say for Black women, especially even professional Black women or Black women who've been through a lot of different things. We just learn to, you know, carry carry our pain gracefully.
But I
You
think
know.
as a black therapist, like you said, black female therapist, I know that's a gift that I have, that I can see it.
Hmm.
So that I can see you carrying it gracefully, but I see it's heavy and I see you carrying it, and I give you permission to put it down in my office for 1 hour, at least 1 hour a week. You don't have to carry it in here.
You don't have to be a strong Black woman here.
Yeah. Yeah. And
I
I
don't
think
want you to be a strong Black woman. We gotta
that's a
let that. We
benefit.
gotta let that go. We gotta let that strong Black woman narrative go.
Right.
I don't want to be a strong Black woman
Well, the
anymore.
reality is I don't know how not to be the strong black woman, but because I'm strong and I'm black and I'm a woman, doesn't mean I have to carry your stuff.
Hmm.
Can I just carry my own? Because I think sometimes not only do we have our own stuff, but we take on the stuff of others. And
Hmm.
so, do you think? So we talked about the pros, that all the positives as far as being black therapists and working with black clients. What are the cons? What do you find as a negative that might be?
Well, one of the negatives I find is that sometimes people expect you to bend the rules because you are a black
Mhm.
therapist, or maybe even have unrealistic expectations because you're a black therapist, right? Like, so maybe they might think that you are going to like, maybe sometimes you'll have someone who would just want to continue to dismiss some of the things that you ask them to do, right? So
Mhm.
you tell them to do homework. Where sometimes I feel like if she had a white therapist with a notepad, she'd do her homework, right?
Yeah, and
Uh,
I know exactly what you're saying. I saw you was like, "Let me see how to say this,"
yeah, I want to make sure
because I
I
know what
want to
you're
make sure I'm
saying.
not. Once this gets out to the world, because this will be broadcast all over the country. Um, I don't want it to be offensive to anyone, but I sometimes I do feel that because there is this comfort, um,
Mhm.
you know, they may not try as hard as they would if there was a white therapist.
I
Or
think that sometimes we get dismissed, because like I mentioned, like the our counterparts sometimes question our resume. I find that even sometimes clients are surprised. So if I say, well, I'm a professor and they'll look at me, Miss Candice, they let you teach over there? Like
Mhm,
if like even though they know we're doing excellent work, they still are surprised that a predominantly white university allows me to be an instructor. Or if they see something, maybe on social media, oh, an accolade that I received. They gave you that? And then the clients are sometimes surprised. So I do sometimes feel like even for the clients who know our resume, they sometimes feel that way as far as they downgrade our skill set. Um, so I find that as a kind of other thing I think it's easier to dismiss. Oftentimes I have to tell them, you can Google this. I didn't make it up, like you said,
mhm.
because you think this is gonna work? Well, it's
Yeah.
evidence-based therapy, so I think it might work.
And I think sometimes culturally we've been taught that white people do it better, right?
Yes.
And so I think sometimes we also have to fight against that because there are some black people that don't deal with black providers, right?
Mm-hmm.
Because they believe that to be true. Like, we didn't get the best education. They were exposed to the best, so they are gonna, know how to do it better. So I
Right.
think it's just about really recognizing what what will be the identifiable things that are going to be the most important to you when you're looking for a therapist, because some black therapists having a black therapist is not as important, because we do have some of us who are very, very comfortable working within different cultures, and that is not a significant issue. Like, they may want an Ivy League therapist. It's like,
But an
okay,
Ivy League therapist could be a black therapist,
right? And
right?
and they could, but I think sometimes people may have their own identifiable traits that they want their therapist to possess. Like, if I had a therapist, I definitely want a black social worker, because I want a social worker. But I probably would want someone who is married, right? Like, if I went to a couples therapist, I probably would want a black therapist who's married.
And so one of the things that I heard you say earlier was about matching. So let's just say I want a black female therapist who's married. How do I go about finding that?
Well, I mean, as a therapist, I know how to find that, but I would probably go to Google and put black therapist. And maybe if she have a hyphenated name, I might assume that she's married, right?
Hmm.
But there's not a lot of techniques to, put in this, like, checklist of what you would like in your therapist. There isn't many spaces where you could do that.
So I know you can call your insurance company and ask, do you think that's appropriate to say, hey, look, I'm looking for a referral for, because we both do insurance profiles of ourselves where we put all
Mhm.
our demographics so they know our sexuality and they know our race and they know our, I think we put marital status on it. I'm not 100% sure. And then we put what areas we're comfortable working in. Would you suggest that if the person was looking for a black therapist, they start with the insurance company and ask for that?
I think a person should be able to ask. I mean, if they wanted a Spanish speaking therapist, they could ask for that.
And what
Yeah.
about asking the therapist when they answer the phone? Like obviously you said, when you answer the phone, I know when I answer the phone, automatically, this is a black woman. I don't
Hmm.
even try to pretend I don't have, and
I don't have
so
the time. I don't have
don't
the
have
time.
the
I'm like,
time.
hello.
So obviously, would you be offended if they said, Miss Naoki, can I ask if you married?
I wouldn't be.
Do you have children? If they just went with their checklist, would you be offended?
I don't think I would. I think because I think sometimes people, if they're, or sometimes I know one big one is sometimes people are struggling with fertility. And
Hmm.
so sometimes they may want a therapist who has also struggled with that. And so, I mean, I can see that being a very touchy subject for someone. But I think if you're going to a counselor for marital issues and asking if that person is married, I don't think that is disrespect. I don't think that's a disrespectful
Right.
question.
Okay. I don't have a problem answering any question you want as far as who I am as a person outside of a therapist. So if you said, "Hey, have you experienced trauma?" Because I want a therapist. Now, maybe disclosing a specific trauma might be a little too much, but I don't have any problem explaining who I am as a therapist, and I don't think it's disrespectful to ask if you feel like you need that specifically.
Yeah, I feel like personal trauma, that might be a little bit extra, but I think definitely just some of like if you specialize, I feel like if you specialize in certain things, people may ask certain questions. Like if
Hmm.
you're saying, okay, this is a service that I provide, or um I specialize in trauma related to the natural disasters, right?
Hmm.
Like, so somebody may say, well, have you lived through a natural disaster? And if a therapist said no, I'd probably be like, I need to know if you know how to,
Right.
what you got to do when the people say you got 3 days to get out, we got a Cat 5 hurricane coming. Like,
Right.
I need you to know what that feels like, getting all of your papers and putting all your stuff up high, So
Right.
I think those are relatable questions to ask.
And so it sounds like we both agreeing that you should interview your therapist. You should
Oh,
before
absolutely.
like this is not something where you just go, you say, "Oh, okay, I found a therapist, she's black, I'm good." You
You're
should
about to tell all your business to somebody you just met. So I think, and I always tell people, you can fire your therapist. If you are not connecting, you are paying for this. This person is getting paid. Either they're paying privately or your insurance or even your Medicaid is paying.
Hmm.
You should not go to therapy just out of obligation. Well, unless you're mandated by the
If you
court.
court audit. Look, this
But,
advice is for free will therapy, court order
yes.
therapy. Don't go canceling.
Don't go canceling. But if you are not connecting, it's been a couple of sessions and or even the first session, you're like, oh, I didn't really like her.
Hmm.
You can give it another try if you want to, but I don't even recommend that. I mean, I think you should explore your options. Find one until you find the one.
Okay, I love that. Find one until you find the one. So, are there anything like if you would say we wrapping up and the people need to know this about black therapists. The title of the episode is Calling All Unicorns, Where the Black Therapists At. So anything you would say, like if you don't remember anything else about this podcast today, remember this.
Remember that you have the right to handpick out your therapist. You can Google them, You can look up their background, even if they put their school, you can look up their school to see if it's still accredited. You can do your research on your therapist. There are plenty of Black therapists, like Candice mentioned. You can go on LinkedIn, you can go to Clinicians of Color, you can, and this is not an advertisement for any of these places.
Thank you.
Um, but you can Google and search to find a therapist who may meet your needs. But I think it's more important to really identify what your issue is that you want the therapist to work on. And if you want that therapist to be a Black therapist or a married therapist or a therapist who also identifies in other demographic categories, then you should also use that information too. And having a Black therapist, it will reduce one of the barriers of you just feeling more comfortable in the experience, but it won't it won't let you it won't prove that you'll just have a successful experience just because your therapist is Black. So,
And so I like when you said that find one until you find the one. Just keep looking because it's possible to find that match. And if the first one doesn't match, fire and find another one.
absolutely.
So thank you so much for coming today. Of course, you're going to be back because we have like two or three different episodes. We said we're going to sidestep and we're going to talk about that another day. So
Yeah,
you're
I know.
going to
I
be,
can't even remember. You got to look back at this video.
don't worry, I got little notes. We gonna remember because there's a couple of things we're gonna talk about again. So you will be back. But until you're back, if people wanted to know what you were doing, anything you want to plug or promote, any.
Well, right now I am in a doctoral program at the University of Kentucky. I will be speaking at the FINS conference at the end of the month. Um, and I think that's about the wrap up for before the summer. So I don't have anything new starting um maybe until August, but when I come back, I'll give you an update on some of those things.
All right. Thank you so much.
All right, bye.
Bye.